Good evening, everyone, and a very warm welcome to today's report launch and panel discussion on the challenges faced by the social sector organizations and the future outlook for the social sector. To start us off, we have Dr. Richa Goval, Director, School of Development, Azim Premji University. Richa, over to you.
Yes, thank you. Welcome everyone again to this discussion on the social sector in the face of the pandemic. And with this, we are also launching a report on the internal challenges faced by social sector organizations during these times. Let me just say a few words and then I will hand back to Annapurna. As many of you would be aware, Azim Premji University has a very explicit social purpose to contribute to a more just, humane, and sustainable society. And as also many of you would know, more than 90% of the alumni from our postgraduate programs, after they graduate, they join different kinds of nonprofit organizations in the social sector. Our faculty also contribute their time and energy to many such organizations and also contribute to much of the work of the foundation, whether it's in the field in domains of education, health, livelihoods, local democracy, and in many other domains. During the COVID times, this engagement has taken on additional facets of work, so humanitarian response, welfare entitlements, currently work on vaccination and some other aspects as well. And through this, we have, of course, through our engagement with social sector organizations, we realize that many organizations are seeing massive changes in their funding and operational landscapes. Whether it's in terms of reorienting their teams for different kinds of work or changes in funding, the nature of funding itself. So that prompted this study, and I'm looking forward to interesting discussion and presentation on these topics. So thanks for joining us, and welcome again to this panel. Over to you, Annapurna.
Thank you, Richa. So all of us are aware of the significant contribution and the tremendous work done by social sector organizations during the pandemic. So, a team of us at the university, we undertook a study to, find out what are the internal organizational changes that the social sector organizations had to bring in order to cope with the demands that the pandemic, the lockdown, and subsequent restrictions have imposed. So today's session, for the next 15 minutes or so, my colleague Rajesh and I will take you through our study and followed by a panel discussion. We are fortunate to have very well experienced people from the social sector joining us today. So I will hand over to Rajesh to start the discussion on the findings from our study. Yes.
Thank you, Annapurna. So welcome everyone for this launch of our study, which we did this year, starting of this year. We did this study, as what Annapurna has said, that we wanted to look at the internal challenges by the social organization. As we know, Annapurna, can you shift the thing? The most agenda for this study, this presentation now, that we will go into kind of 4 aspects that we will cover during this presentation. One is the motivation of our study. Next will be the objectives and methodology. How did we go about this study? And we'll discuss a little about the finding, and we'll also discuss about the way forward, which we did ask our SSO heads of how do they see the organization, the whole SSO, in the future. So this will be the agenda of this presentation. As we go along, you can ask questions, but we'll keep the questions towards the end of the presentations. Yeah. So, uh, Annapurna, the next one. Okay. So, as Annapurna has said, and Richa also, the objective of our study is we covered some five aspects in our study, five components. One thing was to look at the humanitarian work carried out by SSOs uh, uh, during the pandemic, especially towards March 2021 to around the 3 months period, or previously of 220 also. The other one, what we looked at was the impact on the existing program as SSO, because by we did on when we covered our study on January, we we somehow came to know the existing programs, what was their status of the SSO's existing programs. The third aspect was the impact on the workforce of SSO, and this was one of our main objective because we were trying to look at the internal functioning of the SSOs. The fourth one of obviously was the impact of funding, because we wanted to know what was the funding impact on the SSOs. As we go along, we will discuss more about it. And the fifth one was that we had a very in-depth interview looking at the future outlook of the SSO itself as a sector. Okay. So looking at the method of our study, we did this study in January, March of this year. That means we covered mostly the first wave of the COVID pandemic, which was there in 2020, from March to December. So we fairly covered that whole range of the first wave. So we didn't cover the second wave so much, but it was the first wave that we what we say very detailedly we looked at. How we did that was we did a survey, a random survey of 107 organizations. I will talk about the profile of the organizations in the next slide. What we did in after doing the survey is also take the inputs from the survey, and we had an in-depth interview of 28 organizations. Now, how did we do this 28 organizations? Is that we did a kind of a profile of these organizations. We did kind of looking at organizations which are big, small. It was a very purposive kind of interview, so that we try to cover all domains uh, of the sectors which SSO works with the various range, and also across the country. So we did an in-depth interview with the heads of almost all the organizations to look at how did they work, how did they innovate, and what was their views on the future of the SSOs. Yeah. So next, just getting into the profile of the respondents, when we did this 107 interviews, which was a questionnaire. As you can see, that we did a various range of SSOs. So one of the things that we came out with, that 66% of the SSO that we interviewed were more than 15 years, were worked more than 15 years on the field, and the others were 10 years, less than, and there were a small number, which was 9%, which was on less than 9 years, which was worked out. We also kept a proxy of looking at the number of employers to look at which was big and small. So according to that, we categorize the SSOs. So according to that, 35% of the SSOs were between uh, the employees between 26 to 100, and 36%, 34% was less than 25, which we said a medium range or a smaller organization. So the medium was around the 35% of the organizations were medium. That was 25 to 100 employees they had. And we had around 31% which had more than 100 employees, which were more or larger um, NGOs were working in this field. Yeah. We also try to look at where these SSOs were working. So what you see is they were working across the country. Now, when we looked at across the country, when we say that they were working 28 and 8 union territories, it means that many of them are working in across zones and across the states. So when we say that there are 69 in the west zone, they might have been also working in the central zone or in the eastern zone or in the south. So according to that, we had a major part of the SSO working in Maharashtra, which was followed by Bihar, Jharkhand, Uttarakhand, and West Bengal, because you can see that the major part of Bihar, Jharkhand, Uttarakhand, where we had more migrants coming in, and the migrants who walked back to those regions. So you had a lot of various of these NGOs who actually worked with these migrants when they came back. And they also worked in different domains of the, as you know, NGOs work in different domains of their work. That means they worked on livelihoods, health, education, human rights, women. But sometimes they might have worked on women with SHG groups, but they might also have worked on livelihood and health. So you will see that NGOs could have also worked on cross purposes on the profiles of it. So next, Annapurna. So let us come to the first objective of humanitarian work. Uh, though many studies have covered this aspect of humanitarian work, we also try to cover what are the NGOs doing, mainly because in any catastrophe or any disaster, we see NGOs coming and working because the NGOs are always there. The NGOs were always there, whether it was earthquake or any flood relief work. But this time it was a little different because it was a pandemic and everyone got involved, because previously it was a very particular type of NGOs who used to work on disaster relief. This time we had all of them, especially according to our survey, it was 92% of the SOs were involved in multiple aspects of COVID relief and response work. Now, what was that multiple relief work? We were trying to categorize them. So most of them. So when we look at this percentages, so it doesn't mean, what we meant is that they might have worked in various aspects of the humanitarian aid. So one of the biggest aspects which they worked was the creation of awareness of the virus, because this was the starting of the pandemic. The lockdown was called, and most of the NGOs started working on the awareness creation, especially on the hygiene part and mask wearing part. That was the most important work they tried to do, doing small videos, sending out these videos of what the virus is all about through a small WhatsApp group or to their own groups to the communities which they were working with. The second aspect which they worked a lot was on food related uh, um, work. Now, when we look at food related work, now this was most of the work because there was a lockdown, and though the PDS was there for a lot of them, but a lot of food related work was concerning the migrants who actually walked back home or who reached the destination place at their place in the rural areas. Now, when we looked at food related work, it was mostly giving rations, running community kitchens, and more importantly, we also saw a lot of SHG groups, which the groups have started, actually also pitching in by collecting rations for the migrants who had come back. The third one was, of course, distribution of masks, but more importantly, linking to government schemes or wherever the government was there to link people there, because the trains were running and you had to coordinate with the local authority on that. Uh, we also had 27% having direct cash transfers, and this was mostly when there was a red zone, where in the red zone nobody could enter. And in those cases, some of the NGO did direct transfers to the shops to give ration to people who didn't have PDS support. And the direct cash transfers also were for people who wanted to return back home through trains, and some of them actually arranged for trucks to get the migrants back home. Uh, so this was, in a nutshell, what the humanitarian work for the SSOs were. So then we'll go on to the second part, which was the impact of the existing program of SSO. What we wanted to keep in mind was, as they were doing this relief work, they were also doing their own work which they were mandated to do, or which they had the vision to do. So one of the challenges of this work which they did was of mobilizing funds, uh, mainly because most of the CSR fund was not there. We all know that a lot of CSR fund went to the PM cares, and that was one of the biggest challenges they had to mobilize funds. And as we go along, we also saw that the SSO was trying to get a lot of funding from the crowdfunding part. And we also had what one of the biggest challenge was physical distancing norms, because we had this lockdown, and we know that most of the SSO work, when you're working with communities, they work very closely with communities, with meetings. This was the biggest problem, and we also run with SHG groups that the meeting was not able to be called. So that was the biggest problem, but they came over that problem, and we can discuss this later on in the panel discussions. And thirdly, was that one of the biggest other challenge was adapting to online mode, because the moment the physical distancing norm came in place, a lot of them started adopting online mode, and this was the biggest challenge. But it came over by actually with a lot of youths and students who helped them to do these online work, how to do online work. So it was very interesting to see how the students helped their parents in SAG meetings or in group meetings to help them to get on to the new digital era, which most of the NGOs also moved. So the last bit, yes, there was some part of it where the NGOs who work with communities also had difficulty to go back to communities because of the fear of the pandemic. There were some communities who didn't allow the NGOs to come into their own areas, which they barricaded themselves. So these were a little of the challenges to implement their existing programs. Uh, uh, Anpurna, can we get the next slide on the thing? So one of the other impact on the existing programs was on the what we say is that on the programs itself, because a lot of them stalled their own programs. Now you can see that 54% of them actually adapted their program to COVID. And this was more important because most of the funders actually changed their own thing to say whatever the existing funding was there, they adapted to the COVID. So the existing programs somehow they reallocated the fund for humanitarian work. There were 31% stalled their few programs and adapted to the COVID for the COVID relief work. You also have a small percentage of them, that is around the 7%, which actually stalled their whole programs and they couldn't do anything. And these were basically mostly small NGOs who were without funds, and they had to stall their program and close their programs. And also we had some new people, 7%, who actually started new programs also. And I think Annapurna will talk about those new programs which the NGOs were able to start. Over to you, Annapurna, to continue with this.
Thank you, Rajesh. So continuing, the findings from our study, uh, one of the very important aspects is what kind of impact the pandemic had on the workforce. Now, we all know about, and we have, heard about the funds crunch to the social sector organizations. We'll come to it a little later, the next point in the presentation. But the kind of impact it had on the workforce. Now, one is, the kind of impact on the workforce because of the pandemic, because of the lockdown, because of the physical distancing norms. Many of the family members or the staff themselves of the social sector organizations falling ill and so on. That was one. The other one was the ability of the SSOs to retain staff because of the funds crunch. So we found that many social sector organizations had to put a freeze on their hiring, or maybe reduce the salaries, delay payment of salaries, or not declare any increments and so on. So we find that, and some organizations actually resorted to multiple of these things. So we can actually see that a significant number have either stalled hiring, salary reduction, and so on. In fact, one of the motivations for our study actually stemmed from the fact when we are interacting with our students and our alumni, uh, they reported, they mentioned that whatever offer letters they were expecting, the offer letters were delayed, the joining dates were pushed. The alumni who were already in organizations mentioned of situations where they did not receive salaries for months at a time, and these were all could be traced back to the funding crunch that the social sector organizations faced during this period. However, some of the organizations, because of they had to adapt to a new way of working, that is use of technology, sometimes even train the communities they work with to use technology and so on. They either had to hire people with new skills or often depend on volunteers as well. So, like Rajesh mentioned, some of the social sector organizations we interacted with mentioned that they work with the children of the communities that they work with, the children in the communities, the youth in the communities who are quite aware of using technology. So they had to rely on them to train the people they work with and their own staff often in using technology. But the impact on the workforce uh, was not just limited to the last 1 year or the last 2 years. This is something which probably is here to stay as for the next 2 3 years, as the future outlook shows. Moving to the what has happened in the last 2 years uh, on funding related issues. So the many of our respondents indicated that the funding meant for their existing programs, like that is, this is the funds that were already committed to them, right? So these funds were either stalled, reduced, or reallocated. Now, the reduction in funding or reduced funding happened because much of these funds were reallocated for pandemic relief. So, a large number of organizations, some 42% of organizations reported reduction in funding. Another 35% of our respondents reported, having reallocated the funds for relief work, and another 24% reported that the funding was stalled. Uh, Looking at, and the previous slide was about the funding that was already committed. And since we carried out the study during January to May of this year, which is the time when many organizations do get fresh funding for the upcoming financial year and so on. So a large number, which is nearly half, that is around 43% of the organizations, reported that they have not received any fresh funding during uh, this period. And yes, around 54% reported that they have received some fresh funding. But let us take a closer look at what this fresh funding is meant for. So, of the 58 organizations that have received fresh funding, most of the funding was for relief work, right? So we can see again. I hope that the graphs are clear enough. The font is clear enough. We can see that nearly 69% of this 58 organizations that received fresh funding, they have received it for relief work from philanthropy, and another close to 60% received from individuals, but this was again for relief work. So a large percentage of the organizations received fresh funding. And as we know, especially funding from individuals and so on, it's not a recurring funding source, and it is probably a one-time funding to tackle the demands of the pandemic. And a reduced number out of this 58. Fewer organizations received fresh funding for continuing their existing programs. So the key sources for both relief work and continuing the existing programs are the philanthropy, individuals, and CSR organizations. Moving on to, many organizations during this period also wanted to initiate new programs. This was because looking at the dire situation that the communities are in, looking at the challenges, the loss of livelihoods, loss of the healthcare needs, the education, and so on, organizations wanted to start new programs. But then again, all this also requires funding, and only few organizations were able to raise funds for initiating new programs. So, nearly one fourth of the organizations reported that, as far as new programs are concerned, they have not received any new funding for their new initiatives. So that shows that many of the organizations, though they wanted to respond to the needs of the community, were unable to do so because of lack of funding. Uh, Once we talk to the organizations about what the challenges were, how they were trying to overcome, and what were the internal organizational changes and so on, we also wanted to understand what, according to them, the future looks like for the sector. So there were four key points that came across, and this was a combination of the responses from the survey as well as from the in-depth interviews that we conducted. And there were four dimensions across which this future outlook or anticipation for future was captured. So one was adopting technology. All the respondents agreed that there has to be an increased reliance on technology for routine tasks, meetings, maintenance of records, and therefore that means there is a need for a greater budget allocation for technology adoption. It was also important, the respondents felt that it was important for reskilling and training existing staff and hiring people with such skills. Um, the second point was about adapting the programs to, uh, the, uh, I won't say post COVID yet, but adapting to the programs during this situation. So, one of the points was that came across quite clearly was that organizations felt the need to reassess their core focus areas. They wanted to consolidate their existing programs across domains because most of the organizations that we talked to worked in multiple domains and across multiple geographies. So they wanted to sort of undertake exercises to consolidate their programs across domains and geographies to focus on fewer priority areas. The organizations also mentioned that they would like to start new programs and expand into new locations, which the pandemic has shown that these are the communities and these are the domains and these are the geographies where there is a real need to work and address the challenges that the pandemic has thrown up. Uh, the third point was that uh, the respondents said that they would like to explore remote delivery of some of the programs through technology adoption. Of course, that also means that training the intended the communities, the people they work with. The third point was about the staff related changes. And as we saw in our findings, uh, the social sector organizations felt that they do need to hire people with new skills, especially those experienced in the use of digital technologies, and also wanted to recruit locally. One is given the funds crunch and the some communities being averse to people from outside their village or outside their towns coming and interacting with them. So the organizations want to move to reducing their overhead costs as well as recruiting locally to establish better connections with the communities. They also see a possibility in reduction in funding that is going to impact their recruitment and salaries and their staff size overall. And the last point is obviously about funding. So much of what we have been talking about now was one of the key challenges was funding. So since much of the funds that are available, donor funds, government funds, are going to be channeled towards the relief work, the social sector organizations anticipate a reduction in funding the next 2 3 years. And therefore, they have to look at new categories of funding, be it from individual donors or raise funds through crowdfunding and so on. So, what is the way forward now in all these? What has the last 2 years actually taught us? And if we are going to live with the pandemic for a few more, in the foreseeable 1 or 2 years, what is it that the social sector organizations need to do? So one definitely on topmost is employee well-being. We have talked about how the social sector staff have been at the forefront of, along with the health workers, of course, um, how they have been at the forefront in ensuring that the COVID response and relief reaches the communities. They have helped the migrants and so on. But the topmost, obviously, is taking care of the employee well-being. The next is to say that how do we train staff and reskill them to uh, uh, to be able to work in a situation where technology is being increasingly used to implement their programs and initiatives. Then the other point is about improving organizational structures and practices. So the the current structures, which actually meant for a lot of in-person work, may have to be thought about, and some changes need to be brought in there. Engaging with communities and other stakeholders to first is obviously with communities to see how the pandemic has impacted, has changed their livelihoods, has changed their health needs, education needs, and so on. And therefore, once we understand the needs, how do we actually come up with initiatives that address the gaps that the pandemic has shown. Yeah. Uh, the other point is about communicating with various other stakeholders. For example, the funding agencies, the local government officials, and so on. Leveraging technology. How do we make sure? I mean, technology not as an end in itself, but as a means to an end. That is one. Strengthening collaborations. We have seen that multiple NGOs have formed collaborations during the pandemic and have learned from each other in terms of the best practices, in terms of leveraging each other's networks, and so on. And so, how can these be strengthened further? That is something that needs to be thought through. Then, how do we build the capacity of grassroots organizations, because they are there uh, in the remotest parts of the country. They have a presence there. So how do we strengthen their capacity to crisis management capacity? That is something that both the government, the funding agencies, academic institutions have to think through. And yes, coming down to the funding, how do we ensure that there is uninterrupted and adequate funding for the social sector organizations in such situations? So, with this, I conclude the presentation of our report. If there are any questions, a couple of questions, we can just take this up now. Yeah, if there are no questions, then what I would suggest is that we start with the panel discussion. And then once the panel discussion is over, we and the panel members will be available to take questions from the audience. So I now request Roshni to take over and introduce the panel discussion, the topic for the panel discussion, as well as the panelists. Over to you, Roshni.
Okay. Uh, Good evening to all. Um, I'm very happy to uh, be. It is my great opportunity to introduce all the wonderful and experienced people in this developmental sector who are part of today's panel. First, I would like to introduce Mary Punnoose. She is presently the Chief Functionary of Prajayatna. She has more than 20 years of experience in the field of public education. Through her involvement with Prajayatna, she has led programs to bring systemic changes in the public education. The organization Prajayatna has closely working with the educational ecosystem to improve and strengthen government schools and anganwadis. And we have another very important panelist, Naveen Kumar Patidar. He is head of the program operations of Aga Khan Rural Support Program India. He has national and international experience in the developmental sector work, particularly in the field of rural livelihoods. He has 14 years of expertise in designing and managing large development projects in the areas of water, sustainable agriculture, rural livelihood, financial inclusion, sanitation, energy, and women empowerment. And we have today another very important and very experienced person in our panel, Anand Bolimar, who is a development sector leader with more than 2 decades of experience of social work in India. His work has been rooted in grassroots activism and been driven by passion and deep commitment for addressing issues of poverty, social exclusion, and inequalities. Presently, he holds dual position of Honorary Director of Partnering Hope into Action, that is FIA Foundation, and CEO of Change Alliance. And today's this panel is moderated by Nazrul Haq, who is a faculty of School of Development, um, Azim Premji University. So it is, I think it's my my role is over here. It's up to Nazrul. Yeah, over to Nazrul.
Thank you. Thank you very much, Roshni. Thank you. Thanks a lot. And thank you, Shashwat, who is my colleague and from communication team. He is managing all of this from background. We can't see him. So he can see us. and thank you for a very great team that has been supporting. And thanks again, Anand, Naveen, and Mary for joining us in spite of your busy schedule. The way we have, and I can see in the audience also some of the individuals from our partner organizations. They are themselves working in the sector for many, many years. So thanks everyone. And I would request audience to start whenever we go, as we go along, right? Start typing your comments and questions in the chat box, and we'll make sure that depending on the time, Anand, Mary, and Naveen will answer some of those. What I will do, since I have the privilege of being the moderator, I'll ask some leading questions to each one of you, Anand, Naveen, and Mary, and you can take your time, and after that we'll take questions and comments which is coming from audience. Is that fine?
Yes.
Yes, thank
Fine
you.
with that.
Yeah, so I'll begin in alphabetical order then. I'll begin with Anand. So since my colleagues Annapurna and Rajesh has just now briefly presented our study and the report that we have just now compiled, I'll just begin with the key question that we wanted to find out through our study. And since all of you are leading development organizations for many, many years, you have been part of the sector. The first question to you, Anand, and then subsequently Naveen and Mary will also answer that. During the last 1.5 years, when the pandemic started, what are some of the key challenges that you kind of faced? How did you overcome? And also added to that, while overcoming those challenges, what kind of innovative approaches you think that worked? Is that clear, Anand?
Yes, Nazrul. Thank you very much. Good evening to all. And thank you very much for giving this opportunity. I would like to appreciate and congratulate the Azim Premji University for bringing very interesting study findings. As we are part of the civil society, in a way you use the word social sector organizations, most of our observations not a big surprise for me at an individual level. And we know that it's a pandemic is not an easy, and it happened. And so there is, in that sense, we faced a similar, I appreciate bringing that quite upfront. But for me, I would like to reflect from my experience of working with me and my team and my communities as a FIA Foundation, where most of our operations are primarily located in the state of Jharkhand, Bihar, Uttar Pradesh, and Madhya Pradesh, but more so heavily in the state of Jharkhand. So therefore, whatever I'm bringing, primarily the contextual you need to put, because civil society, social service organization, the sector itself is quite wide and different kind of expertise, skill sets they come. So I don't think one particular aspect would be, cannot be applied. So one has to look into the context. So this one way, the COVID was an equalizer in that sense. It affected everybody, whether you are rich or poor, whether living in rural or an urban area, everybody. Same is the case with every organization, including the private sector. State itself has taken a surprise, and the civil society, as in a way, we also taken up, affected by it. But what it is important process was that yes, initially it took some time for us to get back to that. It's not that we have prepared for a huge emergency like this. And apart from that, and also the lockdown, stringent lockdown coming with a short notice is something which I think it requires a different kind of a preparedness. So in that sense, we could sail the field. But what it happened was this: the initially we took a couple of days, to an extent a week plus, to adjust to the new situation, and also try to look at, first you need to take care of yourself and your own family where you are, because it's all, everybody got affected. But at the same time, the moment the stories start unfolding, we realize that it is not just you're being safe sitting, being online alone is going to put, because this is where the communities we work with day in and out, day out, we know these other communities are facing much more lies, though it is an equalizer, but people of different communities affected differently. So the impact on the migrants, the impact on the people who are living on a very informal sector, very hardest hit with this whole process. And these are the constitute the majority of our communities. We have to respond. So in that sense, it took some for us. And yes, we did biological process. In that sense, there was a little bit of a time it took for us to equip ourselves. How do we take it up? But apart from that, in a way, innovative way, adopting to the new technology is a very important, and that we try to do it quickly, thanks to some of the technology platforms quickly helped us to connect with each other. But what it has come is also we immediately innovatively, in that sense, maybe second part of your question, I can take two parts. One, we realized this the magnitude of this problem. It's easy to sit on a wall and blame, criticize everybody, but also how do you respond within your own limitation, and also how much we can consume. So two things we did. One, FIA Foundation work in civil society partnerships. We connected with all the organizations, try to connect with what's happening in the ground. The second area is, prior to that, last 2 to 3 years, we implemented a very innovative program, in a very important program called Internet Sathis. So where we work with about 23,000 plus young women as an Internet Sathis who are there within the villages located. So we quickly activated them, and they're all already on the WhatsApp groups. They're very much available. So it did not take much time for us to connect with the amount of data that is coming, the amount of distress calls they're receiving. That's where we realized that it's going to stay a little longer time. We need to prepare, respond for that. So most of the, like the same study findings, most of the programs in a way come to a halt, and we try to do a repurpose most of the programs. Thanks to many donors who are part, including the Azim Premji Philanthropy Initiative. Now presently, APF has been, most of them are quite open to repurpose the budget to respond to that. So in that sense, that was helped us to do. The second part, what we did as a FIA Foundation was we reached out to the state of Jharkhand government, and we see that the amount of migrant crisis that is coming up. We said we have small team, we may not have full technology, but we want to be part of this, how we can help. So when all the offices are closed, they have asked us to join the helpline, what you call migrant control room. And it was something which for me is a very quite heartwarming, because there's no such program, no proposal, no project, everybody closed. But it is the voluntary support of the people, network members, and Internet Sathis. Many people just walked in, just they want to be part of this, try to help the migrant crisis. And the state has opened up their offices, technology, everything. That was quite an important, a crisis of magnitude of like this could not be responded without the collaborative process with the state, with the private sector, with the communities and the volunteers. That's how we have done that. Thank you. Over to you.
Oh, excellent, Anand. And this has been, I mean, we have been hearing similar sentiments from almost many parts of India. So, Mary, would you like to go next? If you can just quickly, if anything.
Good evening, everyone. I would like to thank APU for this opportunity to participate in this panel discussion. Yes, when the study was going on, I found it very interesting. And I think the findings also is something that all of us have been experiencing and going through it also. So it kind of resonated with what we as an organization, I think all of us are going through. Again, congratulations on the report, and I think a more detailed look at it will be even more interesting. So getting back we have faced. So Prajayatna has been working in the education sector for the past many years, and we work exclusively with the government schools and government anganwadis, and mainly with children in the primary section. And we work with the communities and all the stakeholders to build conducive ecosystems are strengthened. So in this context, when COVID hit us, the first wave, so for us, took time for us all also to kind of grasp the severity of the situation. Initially, we all thought, I think, in 2 months schools will reopen again. Anyway, it was summer holidays when it actually COVID hit us. So initially, the first thing was, like, how do we get through this lockdown period? Most probably by June, July, everything will reopen again, and we can get back. But then as it unfolded, and the situation was, the severity of it hit us. So initially, like, I think, again, like all of us know, the kind of misinformation and the rumors that started going around, where, and villages were closing down, not letting, and we exclusively, most of our work is with the communities and with the schools, very physically, with teachers, with parents, with the school management committees, gram panchayats. So then many of the villages actually closed their entrances, especially Jharkhand. I think Anand ji must be knowing, in Jharkhand, many of the villages actually barricaded the entrances. So we work in Jharkhand also, and UP, and in Karnataka, and it's mainly in the aspirational districts. So initially, our work, a lot of it went in kind of awareness, giving information, and a lot of our work, again, for the team to home. So then from there, in turn, and most of them are also from interior places. So kind of for the team to kind of get together, grasp the thing, get onto platforms. For us also, it was a completely new experience, getting used to Zoom, Google Meet, and all this. And for as a team, I think the learning was, how do you operate, where we are very used to physical operations, meetings and plannings and things. So all these kind of things were something that first, as a team, we had to kind of get used to. And then when we actually saw the kind of impact it was having on the communities, so then our response was initially a lot of awareness building using WhatsApp, creating posters, messages, sending through WhatsApp, calling up people we know, school management committees. And that was the focus in the first wave. Also in seeing that how we can work with the panchayats, and seeing that the PDS was being distributed properly. People who were actually affected were getting the kind of were able to access schemes that was being announced by the gram panchayats, by the state governments, and things like that. After that happened, and we realized this is, we are going in for a long haul, and schools and anganwadis didn't even seem to be thinking of opening. And at that time, we were also in a situation, I think we all know, that communities were also more impacted, and looking at it from a more survival point of view. And so for them, education took a backseat. And it was also to see, how do we connect with children, how do we connect with the communities, because as the time was going, you're also seeing the kind of learning loss that is happening. And I think all of us are talking now about learning gaps and the kind of learning loss that the children. We looked at different forms of e-technology, trying to reach children through using low technology platforms like WhatsApp and things like that. And that has been content which is engaging, interesting, keeping parents in mind, keeping communities in mind, because finally they are the facilitators. You do not have teachers around. Some of the challenges that we faced, in fact, how do you actually get communities to be able to access even WhatsApp? It's very strange, actually. We hear things of messages and information going viral, but when it comes to education, you realize that not even 10% is able to access the kind of information that you're sending. So it's a very, it's a dichotomy. How does this happen? On one hand, you're saying, one message, it reaches all India. But when it comes to sending education content, then it is very difficult, especially in the communities that are access to technology of this kind. any sort, even WhatsApp, we did not use very high tech. Then so that was the challenge that we faced. And how do you sustain this interest? Initially it was when parents were at home, and they were able to access phones and all. And then once they started moving out, lockdown lifted, and parents started going out, then this whole and then how do you get the children to access it? So these are all the challenges that we face in terms of program. Now, when it comes to teams and funding, again, like I said, for the team to get used to technology, planning online, meeting online, you also realize you're able to do it. There are a lot of things that can happen online in a very efficient manner also. But to get to the getting, how do you actually make your program also adaptable, like say to teachers and to different community members, was something that the team had to learn, and we needed also that kind of skill sets, which was a challenge initially in the when, since the entire program and everything had to be your outcomes itself had to change. So then some of our donors, so we had different kinds of reactions. So most of our donors were quite open and understanding, and they themselves came forward to see how the program can be restructured, reoriented, repurposed, and see what is the need at that time, and how can one use the money that was there to reach that. And on the other hand, we had also delayed funds. We have had funding which has been delayed like for 6 months or more, especially from PSUs and different things like that, where that also has affected, of course, the quality of work. And also, if you want to do new things, the challenge where funding has been an issue, or even using these funds for new things has been a challenge for us. And so like I said, it has been two kind of reactions. So most of it has been favorable, in the sense they have repurposed it. On another hand, you've had this kind of also. But yeah, so those are some of the challenges that we have faced as organization.
Yeah,
Thank you.
thank you, Mary. We'll come back again. So meanwhile, I'll go back to Nabin, and if you can just briefly state from your experience with AKRSP.
Yeah. So thanks for inviting us. In our experience, like the last year, the crisis was induced by lockdowns, while the crisis in the current year was induced by severity of pandemic. So last year, because of lockdown, a lot of migrants came back to villages. There was shortages of food. Then there were issues of people not having cash for continuing the agriculture in their farms. So that kind of crisis was there in the first wave. And AKRSP being a livelihoods organization, so while our first response was, of course, all around food security, ensuring ration, awareness, all these things, but then we were also very much worried about the livelihoods of the rural communities, particularly the farming communities. And there we saw two kind of problems. One was farmers were not having enough cash for buying inputs for continuing the kharif season in 2020. So they needed seeds, fertilizers, or any other kind of input support. The second is, of course, the markets were closed. So how farmers access markets for commodities, as we know, the poorest communities in rural areas, they keep poultry and goats and that kind of livestock assets. So those kind of markets were closer for even longer period of time. So they were closed for even longer period of time, and they were facing a lot of problems. So in such a scenario, our response was twofold: how to support the market access, and how we support farmers for continuing the farming and livestock activities. Of course, through subsidized and free of cost input support through the whatever support we received from various foundations, philanthropies. Then the second aspect is, of course, the organizational one. So, as an organization, how we deal such situation. So, one is, of course, we relooked at this the social security and security which is offered by organization to our own staff, whether it is health insurance, life insurances, and in fact, we decided that because of this crisis, we will not ask anyone to leave organization, at least in the shorter period of span. If the crisis continues, then no one knows. But as an organization, we decided that we will further strengthen the support system for staff, their families, and I must say that many of our key donors, key funding agencies were all in favor of strengthening this kind of support to our teams, our CRPs on ground, that kind of additional support. One thing I want to mention is because of this crisis, one good thing which has happened is collaboration between civil society organizations. So, for example, we are part of a large network called RCRC network, and it was not there before the crisis. And we found that because of CSO leaders coming together so rapidly, and there was a minimum program which was put in place. So initially it was all around relief work, and all the CSOs collaborated for not only for field level implementations, but we did lot of surveys, which actually helped in getting the insights from rural areas, what is happening in the hinterlands. So that kind of collaboration helped in, and some of these reports actually came out into limelight, and they were published in media and all these things. So that was very helpful. Second, now because of this collaboration is in place, it is planning for its next phase. That after initial relief response, what is there in long term? So can we look at longer term programs in terms of livelihoods and other things? So yeah, in totality, collaborations, technology, strengthening our support system for employees, and the most important thing which I think what we experienced is because of the uh, community groups and institutions on ground and the social capital which was generated by civil society organizations over the period of time, it was extremely useful during the crisis because there were restrictions on movement, on logistics. So the community leaders, the community groups, self-help groups, federations, they were extremely useful in terms of not only the relief work, but connect farmers to markets, for agriculture, all other things. So I stop here for the initial comments. Thank you.
No, I think Naveen, you have raised a very important point, and this was coming in our study again and again. That although we are going through, and we are still going through a big crisis, an unprecedented crisis, it also showed us lots of new avenues, right? For example, the collaboration amongst NGOs, amongst social sector organizations. That was one key finding in our report itself. So that actually brings me to the next question. And again, I'll go back to Anand first. I mean, although unprecedented COVID-like crisis, I mean, it may not be a health crisis, but it can be something else, right? It can come from climate change crisis or something like that. I mean, we are certain almost that this is not going to be the last such big crisis, right? Last such big global or national crisis. So that's why while thinking about the crisis, it's also important that what insights we could draw from it, what learnings we could draw from it. And I think social sector organizations are because they are in the forefront of fighting this with the help, kind of mobilizing communities, helping communities. Even now during the stage of vaccinating, what are some of the points what you would like to share in terms of the learnings or insights which can help us in the future, which can guide perhaps short term and long term?
Thanks, Nazrul. I think the the point is, I certainly wish and pray that we will not need to face through a similar challenge again, at least in our lifetime. But at the same time, it doesn't, it's not the pandemic of this nature, but the climate related crisis, induced crisis, is much there on our edge. We are seeing almost last couple of years the amount of disruptions it is created and how it is impacting of all walks of life. So we need to prepare for that. How do we face? Certainly, I think the like FIA Foundation, apart from long-term development, we also engage on the humanitarian response. One of the things we always say is the DRR, disaster risk reduction. The second language which we use is about preparedness. So the best way to prepare is how do you face the disasters is you prepare. Then apart from that, we also talk about the resilience. How do you build the resilience knowing that this is going to happen? So how you are going to face that? And it's all important from my own learning was that when we as an organization, while we are facing these challenges, but we also realized gone are those days where you see that the humanitarian response is a separate stream and long-term development takes its own time. I think this crisis has brought, you can't see it separately. You need to, every person have to be a humanitarian responder. Every person need to be a fundraiser, and everybody person need to be a long-term orientation response. That in that sense, it's equally important. And the second is also about the count on every resource. Sometimes not necessarily. This has also helped us to identify many people whom we normally have not interacted. If you ask FIA Foundation per se, we never think that it is the health is the one of the priority in which we to respond, but now it become one of the major area where we started off responding, not necessarily as a technically sound health responding organization, but preparing, working with the communities, bringing those awareness as well as the practices and what are the various preventive measures, how they can able to protect. That's it. A lot of myths around the community. How do we prepare? So it's important that how do we be open to various kinds of relationship and count on every resource that is available. Be open to the partnership. I mentioned about a FIA Foundation able to establish a very strategic partnership during the crisis, during the lockdown. On the third day of the lockdown, we decided to work with the state, and then the state welcomed us to take it up. Is a very important response. It became one of the important response. It touched close to 1 million migrant workers struck different ways. We did not do it alone as a FIA Foundation. It's the civil society organization network collaboration of over 600 organizations spread across the country able to respond saying that so-and-so district know this process, this is what we have to give a distress call. There is a civil society able to respond without looking where the resources are. That's where the collaboration means about a civil society organization to do that. We need to prepare. I think for me, it is an important aspect we need to prepare. Apart from that, so far, most of the responses are in and around the relief work. Relief is equally important. Working on awareness is important, but it's not only the life. Naveen, in fact, he touched that point. Life and livelihood seriously affected. You remember, millions of people want to walk back even in the absence of transportation facilities. Once the pandemic, that fear got over, again, most of them try to go back to various lack of that kind of an opportunity, livelihood opportunity, knowing that they are vulnerable, but still they have no choice, they're going back. I think this is something which we need to take it as a very important dimension. So both life and livelihood, both are important. Relief alone is not sufficient. To an extent, majority of us thinking that we have done a lot of relief work. Yes, it is timely, but I think the long-term to medium-term rehabilitation, long-term orientation, how do we build back better? I think there's a lot more gaps still need to be filled. That is something which we need to look into that. And another important aspect is not necessarily that how do we build partnerships and collaborations, not only within the civil society, but also ability to engage, reach out to the other sector, whether it's a private sector or a state or even into a health sector. This is something which brought us. We learned that how do we leverage, not necessarily in the post-COVID process, we are working in an isolation. As if there is a health, we'll take a help from somebody else. If there's a required technology, we work with the technology partners who can able to chip in. I think these are all the learnings that are coming up. Be open. Partnerships brings you the scale, but closer to the community. The reason we responded, we never worked on a serious issues of migration, but we Post the pandemic, during the lockdown, we responded to one of the largest community response was because we closer to the ground, we realize this is what the community needs are, and we are able to amplify, engage with the support organization, including the state, whether it is a direct cash transfer or bringing about awareness level or bringing back some of the stranded community members back home safely. These are all the things is possible due to collaboration. This is something which not only for the civil society, but the state, including the donor agencies, need to learn from it, and how do we nurture it so that it's not we are responding in an isolation, but we are responding to a larger process that requires a larger collaboration and integration. Over to you.
Yeah, excellent points, I think, Anand. And Mary, I would like to again go back to you on the same question. What would your response?
I think in terms of one thing, I think as a community, as a country, I think we also need to look at the kind of social capital that we have and look at how the community can use that. In many of the work that we have done, we have realized that communities have their own strength. And like Anandji said, it is a social capital that we have generated us to do the kind of work that we have done, that we have been able to do in the communities. And there are a lot of strengths. There are networks within the community. We have had youth come forward to work with children. We have SHG groups which have come forward, to provide their phones for the children. Different kinds of strengths are there in the community. And even now, when we're looking at the issues that are there in terms of, I will talk in terms of education because that in itself has been affected, I think, tremendously. I mean, even now we have states where schools are not open, and of course, leaving aside Omicron, it's like going to be 2 years, and we have primary schools not reopened. And so, what is the kind of future that we are looking at? And we are talking about communities which do not have other kind of options or do not have other kinds of exposures for the children. So, of course, children are learning. We are not saying that there is no learning without schools, but then the kind of learning loss or the gaps that we are seeing when we work with children, even in groups through mohalla classes and through other ways, it is, that itself will take another 10 years for you to overcome. The kind of work that organizations have done in the education space for the past 10 years has kind of been undone. So how do you use and how do you also involve the communities while taking these decisions? Like we all know, the kind of impact that has been felt is more in the rural areas, it's more in marginalized communities. Of course, this is a equalizer in terms that everybody has been affected, but definitely the impact is more on marginalized communities and on children from these communities. So as a country, how do we look at children? I think that is something that we need to look at. And that kind of course, you're saying you're sensitive, you don't want children to be affected. But then on the other hand, you are seeing, increase in child marriage, you're seeing increase in child labor, you're seeing increase in everything concerned with child statistics. So then, how do you decentralize decision making is, I think, something that we need to look at, and it cannot all be top down. Even in crisis situations, you need to involve communities, you need to be decentralize this decision making process and see that people are able to articulate what even their thought is. Another thing, like everybody is saying, collaboration has been something that has been, we have been seeing it being fruitful, especially at the district level and at the state level with states and with district offices with the DCs and with different organizations in the district. We have seen everyone come together even during the first wave, during the migration when people were coming in. Now during the second wave of vaccination, for awareness building, so vaccination camps, all this is being done at the district level with all organizations coming together, and that it is being very effective. And we have seen a lot of things, and I think this is something that needs to be continued to resolve issues that you're facing at the district level. You have to be extremely innovative and see what needs to be changed. You cannot stick to what your program design was. And we also need to work with the donors to see that this is something that changes. And especially now when we are seeing things are so overwhelming, what do you say? It is not, nothing is being, you don't know what changes from day to day. So we need to also be innovative and change as according to what the demand is, and be able to work with different stakeholders and with donors to see that they also that change is reflected in every way. Yeah, that is something that,
Yes,
that's
yes.
it from
Thank
my
you,
side.
Mary. Yeah. So Naveen, yeah.
Yeah. So, my thinking is that civil society organizations has to be highly resilient from now onwards. So it's not only pandemic, but for example, AKRSP has seen, let us say, floods in some of our areas from last year. We have seen cyclone in some of our areas, and on top of that, we have pandemic-related issues. Plus, we need to see the regulatory changes which has happened. So the FCRA changes and all these things. So in terms of resilience, we have to be very holistic. We have to look at how we adapt our programs. We need to look at how we deal with climatic issues. Then how we look at changes which are happening in regulatory frameworks. So, for example, our funding has to be diversified now. We cannot remain depend on the past way of working only through projects. So, like in the corporate entities or any other uh, institution, there has to be some, let us say, contingency funds, some reserves which can be used flexibly when the crisis happens, or we need to design any program very in a quick mode. So that kind of support, or that kind of, let us say, reserves or contingency funds may help civil society organizations. We need to explore newer kind of instruments. It may be, let us say, newer things which are coming up, like social stock exchanges, or development bonds, or new kind of instruments are being there, which needs to be looked at. I'm not sure how much they will be successful, but we need to build in resilience in terms of funding situation of civil society organizations. Uh, then I think in terms of livelihoods of rural communities, two things will be extremely important going forward. I think it is right time to put further investment into farmers collectives. So for all these years, there was very thin investment into farmers collectives, whether these are cooperatives or FPOs. But because they are on ground, they can collectivize, they can reach market through their collective efforts. So we need to put in bigger investment, long-term investment into these farmers collectives, and particularly focusing on women farmers, because in the past, women farmers were not much beneficiaries of this kind of initiatives. Second will be how we look at local employment opportunities for the rural youth. So the kind of job insecurities we saw during the crisis, people were forced to leave their jobs. They came back in a very panic mode. So we need to ensure that can we generate local employment through micro enterprises, any modern enterprise in rural areas, services in smaller towns, so block level towns, district level towns. So we have to look at newer avenues of generating local employment, where youth can find not only the meaningful career but also kind of social security and other kind of securities. Thank you.
Yeah, I think, yeah, so that's also, I mean, when I was hearing all of you, and also similar things I've been going, we have been hearing from others. One thing is very interesting is that these insights are nothing new, right? I mean, these are all we know, tried and tested. But all, I mean, we always tend to forget. We always tend to move away from these necessities or realities. Basically, be open, be local, go local, find local solutions, collectivize, come together, find solutions, try to work with multiple stakeholders. But somehow during our day-to-day kind of way of working, we always tend to get isolated, and the whole process of centralization because of state, technology, and market, that has also led to devastating impacts. And that was very evident during the COVID crisis as well. And communities were badly affected also because of some of these repercussions that we have ourselves created. So my last question, and again, I would request the audience members to type. I can see some of the interesting comments. One is on FCRA. And we all know how these legal changes are also impacting the sector. And when sector is impacted, that means that the communities are also being impacted. And less money available, there's more difficulty. And I know personally the many smaller NGOs who have completely stopped functioning. Then what is the future for the social sector is one question coming to everyone's mind. Not now, but this is much more evident now because of the entire crisis. I would like to know from all of you your response on two aspects, again linked to the pandemic. One is the use of technology. How do you see social sectors evolve? And secondly, the community engagement. Is there going to be any change the way we work with communities, the way historically it is understood community engagement? Yeah. Yeah, I think Anand, you are ready to begin, so you can.
Okay.
Thank you.
Thanks, Nazrul. I think quite an important point you have raised. One, I think the message that are coming up, we know that technology plays an important role. How do we play that? Like majority of the civil society organizations, SSO, it's like we run on a hard to hand mouth. So not necessarily you are unless you are a very big organization, have resources. So many majority of the NGO sector do have a huge deficit in terms of the resources and access to technology. This is something which I think the donor community need to consider that how do we equip the sector organizations to can respond. So there should be some kind of an investment really during the once you hit the emergency and then you respond, but how do you prepare so that any future eventualities one can respond? So that's an important aspect. The second area is also most of the times we say as a going forward, I wish at least as a FIA Foundation or majority of us, we feel to create an emergency response fund. When you hit an emergency, then you take your own time to prepare the ground, get the data, and then put it, submit a proposal, approval comes back. By the time most of the systems are not working, there was a delay in that sense. You see that how do we reduce that? So therefore, how do we equip so that once you do your diligence, once you equip the process, how do we ensure that the access to resources, the ability to quickly respond is ensured, so that there is somewhere a responsibility to work that particular aspect. And the third, I think Mary also touched, though it is an equalizer, everybody got affected. There are marginalized communities that are very severely affected. Adivasis are to an extent, manual scavengers are people who are engaged in the majority of them are in the informal sector. They're hard hit. During the crisis, as an urbanite, as a middle class, I can tell you, we let down our own workforce. We didn't do that taken care. Had they been taken care during that crisis, post-pandemic, I don't think that sector or an economy as such wholly will be having this kind of a challenges. So it's an important that how do we take care of our own people who are our growth engines, who are invisible workforce. That particular segment need to be looked, and it requires a proper compliance of the law. Having a law alone is not going to respond. We know that the data is very much with us. So how do you take care of your whole recruitment process, respecting those rights, compliance of the law, access to social securities, and having that critical times response? That is something which I think one need to respond. The third point I also want to mention is about that always we say that, okay, majority of the people are moved out of the rural villages where we work in Jharkhand, where you have high percentage of migration. But many people have come back and they want to stay back in a village provided they get a proper livelihood. So the whole issue is the skilled force, skilled migrant community members have returned back. It's no longer we are saying not skilled. They are skilled, but they're going faraway places in search of the work. How do we create a livelihood opportunities for them? In that sense, how do you build the skill set to completely look forward to a rural livelihood in a new space where you can create those multiple experiences together can be able to take it. So therefore, I think it need to, how do we look into this development paradigm in a much more nuanced sense, including looking into the issues of marginalization, inequalities. Those are the things that I think one need to look into that. And apart from that, we also see, yes, there is a certain comment on related to FCRA. This is a challenge. In fact, during the crisis time, Niti Aayog has organized a consultation with the civil society, couple of consultations. Subsequently, later part, we have certain high people in the government sector. They talked about civil society. Supreme Court made about the contribution made by the civil society. There is a trust deficit. I think we need to move beyond this. Whether you are rich or poor, it doesn't matter. When an emergency hit, it hit everybody, some people badly. Therefore, you need to respond. So if the state and the NGO sector, civil society can work together, we can leverage much larger space. So we know that state has a much larger space. But if you want to reach to the most marginalized, excluded, and very hard to reach areas, the civil sector has proved that their ability to reach and fill those kind of a very, very what we call a critical gap. That's where we need to appreciate and see the strength and opportunities of each other and how we can work in a collaborative way. And also the last minute is not to wait for the disaster to come again. So how do we prepare before you face the next disaster? That requires a preparedness, investment, equipping those skills. These are the things which we need to work, what we call in a normally a peacetime, where you need to prepare. So I think this is where the combination of all these things we put, I think we'll be able to better prepared and able to respond. And it's all about collaboration, partnerships, trusting each other, and closer to the communities and build back better. Over to you.
Yeah, and to Mary, actually, I would be much more specific because you work with schools, with education. How do you see the whole use of technology now? And of course, there is huge disparity. We all know that. But do you see any change coming since you are on ground?
We have, I don't know, it's a very difficult question because everybody's talking about technology, everybody's talking about e-tech. In fact, now if you see the most companies making money is the e-tech companies. Take anyone, Byju's or anybody, they are the ones who are making the most of it. But you have more than, now the number of children going to government schools after the pandemic has increased. As we all know, once where it was 55 to 60%, is now going up to 65 to 70% of children are now going to government schools. We don't know how long it will last. Probably after some time that they will go back to private schools. We don't know. But definitely the number of children going to government schools has more departments pumping content over WhatsApp, over YouTube. You've had in Karnataka, you had TV channels, you had all kinds of forms, all kinds. Even the state departments, it's not that they've not tried. We need to appreciate the effort that has gone into it. In every state, they have tried all kinds of things. But when you see the kind of reach, it's not even Jharkhand. We were kind of trying to see how many. It's not even 5%. And now after the second wave, it's completely thing. Everywhere. It's not only. I'm just giving Jharkhand, UP, Karnataka. Even though Karnataka, the reach is much more. They say it's around 40 to 50% in terms of technology. But when actual children accessing it is very less. So unless there is ensuring that children are able to access that in terms of investment in the schools, in maybe panchayats, and with people having access to children having access, not only adults, because adults have their phones, but children are not able to access it. So that has to be something that the state has to look into, even if you're looking at, technology being used, leveraged in that extent. I definitely agree technology is important and we need to use it in, even in regular school, you need to use different multimedia. But how much of it is able, so that is a question. And for me, education is a very much personal, social interaction. So without that, and saying that everything will happen on technology is not something that will happen in the near future. But of course, you need to have some kind of awareness has to still be there, especially when we are talking about the larger segment of children, which is the government school and which is a marginalized thing. Again, here I would say we have two kinds of thing where you have the urban and the middle class and the upper class, which has access to online. And so even when schools are opening, there are, as we all know, in the cities, most of the schools have not yet opened, even though they have been given the permission to open. But parents are not sending because you have an alternative. Whereas that is not the case when it comes to the other side. So yeah, for me, it is still, we are a long way away from there, I would say, and we need to be much more
Yeah. Of course. I mean, Naresh from Manjari Foundation has also commented that the digital divide is actually bringing lots of inequalities, right? And education is one. And we know from, because Azim Premji Foundation's direct work is with school education, and this will impact
Yes, studies
generations to
also have
come.
shown that.
Yeah, and this will impact generations to come, right? And one whole generation may lose out, and then what will happen to the
Yes.
subsequent, the next people. Naveen, again, someone was saying during pandemic, community engagement was very challenging in rural areas. We all know that. Since AKRSP in livelihood, sector, I mean, you have to go out and be with the community. I mean, as part of your regular work. How do you see it being evolved? Do you see any change in that approach or model in terms of the future?
So one of the thing which I think we are also considering very seriously, and in fact we are working on this. And so, how we see the role of local governance institutions. So, in terms of community engagement, um, so when crisis happened, was there any role for panchayats and gram sabhas? Were they not responsible for looking after the migrants, the most vulnerable households in their own villages? In fact, we found that most of the panchayats did not had that kind of list with them. That where are their citizens? Who are the most vulnerable? Can they be linked to some food security schemes or some livelihood schemes or no. Even in education sector, what is role of local governance institutions if they cannot take care of children in their own villages? So I think going forward, the role of gram sabhas and panchayats will be extremely critical. We have to empower them. We have to build their capacities to look after their own citizens. If panchayats keep doing only implementation of projects or programs like the activities on ground like toilets or drinking water schemes, which is very important, but ultimately they are governance institutions, so they have to govern their village. They have to look after the citizens in the local governing institutions, and that might be very useful in terms of strengthening other institutions also. So if panchayats are strong, the gram sabhas are strong, they can take care of, let us say, local self-help groups, farmers groups, market linkage issues, that kind of
Schools.
engagement is needed. So I think the role of panchayats in terms of not only implementing schemes on ground but ensuring that the most vulnerable gets their dues and they are taken care by the local government institutions will be extremely useful. in terms of, I think, technology, I would say only one thing. One is technology for organizational functions like fundraising, accounting, all these things, MIS, surveys, that kind of function. Second is technology for enhancing the efficiency and effectiveness of local production systems on ground. So whether it is agriculture, livestock, or local artisans, so how they get benefit out of technology, either through financial inclusion or market access or that kind of initiatives. So that will be, in fact, very useful if we empower local groups, leaders, women leaders with these simple technologies, which can help them improve the efficiency, effectiveness of various production systems, schemes, entitlements on ground. Thank you.
Yeah, yeah, and I think I could see one comment on that. That local democracy already has that. Yeah, yeah. I would come to Anand also because FIA works with panchayats. I know. Yeah. So if Shashwat, can you show that comment? I could see it. I mean that they already. Yeah, it's yeah. The first response to disaster happened at the local level by the community. So building this component is very true. So Anand, what is your observation? Because FIA works with local democracy very closely. You have to unmute.
Thank you. I agree with the broad points made by my other fellow panelists. One thing I think what we responded to is the technology within the organization, how it can equip the organizations. But let us also, when the moment we apply the same access to technology to the communities, to the children, there are issues of, there is a gender divide, there is a social divide in terms of access to technology, and also the affordability. A lot of issues are there. So therefore, what we carried away with the so-called urban image, not necessarily that's the same reality in the rural areas. And there are few villages still we don't even have a signal, so leave alone having a mobile will not work. So therefore, I think one need to be realistic in that sense, and where I see a state has a larger role to play. And if we can able to roll out we have a lot of technological innovations within the country. Our scientific community is quite proud, and we have such an advanced technology, science and technologies. I think somewhere some of the structural issues of having that access, equitable access, is an important dimension that still need to be addressed. That's where both in terms of access to hardware, software, and ability to use it effectively without interruptions. I don't think it would have been easily, according to the number of kids going to the school, would have able to give them a mobile with a proper internet access. That is possible. But we also know, I mentioned initially we implemented Internet Sati. We know that access to women within the family to the mobile and the internet is also very much limited. So it is not, there's a huge gap between the men and women access. So kids is altogether a completely somewhere a no-go zone or a very less privilege. So therefore, I think one need to be put in. Coming back to the larger issue is about, yes, on the, I do take the point what Naveen has mentioned. As a FIA Foundation, we're working on the local democracy in the state of Jharkhand. At least the places, I cannot vouch for the entire state, but the places where we worked, we have seen a wonderful response that if the Panchayati Raj institutions, very critical part of the governance structure, if they are equipped, and Panchayati doesn't mean that the people who are paid full-time, the elected representatives, ward members, and Palisava, this, if we can equip, they become a frontline responders. I'm the one of the survivors of 1977 super cyclone in the south. And I know the first couple of days, nobody comes. It's only community themselves will take care. At a later part comes the civil society or the state or somebody else. So it is important point in a DRR where we talk about, that's why, how do we equip the communities with the knowledge, awareness, technology, and preparedness to respond is an important element. A community-based disaster management model need to be prepared. We have NDMA, DDMAs, plans or disaster plans are there. But how do we make those plans available on the paper, put it into a regular practice, and with a proper resource matching and response mechanism? This is an area where I think there's a gap between the lip and the cup. That is something which we need to put it together. And if we have an equipped, properly built, engaged Panchayati Raj institutions, they will be do. And this is where most of the COVID response, when the migrant community started off coming, it is the Panchayati Raj institutions, in at least in the work area where we are doing in Jharkhand, was handled by the members themselves. It's not that FIA team has handled. So whatever the credit we are taking, I almost measure the credit goes to the community members who responded. It's a community-based organization, self-help group. It's elected representatives, and these are the people who actually responded. I think this is where my confidence and commitment goes back into that. How do we equip them in a normal time with appropriate resources, knowledge, so that they will be able to respond, and the rest of the state or the union and the rest of the value chain is about to support them with a proper timely thing. That is something which we need to keep that in our plans. Over to you.
Yeah, thank you. And I think that, we all would very much agree. Mary, you have some comment? Please go ahead. Yeah.
No, I was just saying that I agree with Anandji completely. Even in terms of education, if the panchayats, we have seen the way panchayats respond, and from that the kind of response, how they've handled even during COVID, the kind of response that they have, the role that they have played. And also, I think when we are talking about technology and we're talking about how do we equip, when I said even invest, we all need to look very seriously at it when we're talking about preparing the community.
Yeah, and I think that we all agree, as I said, and I know that for last many months we have been having similar kind of discussions everywhere, right? Lots of webinars, lots of writings have emerged, but still, it's important that we keep reiterating these very, very basic, fundamental yet very, very solid points. That how do you make sure that communities representatives are strong, they are empowered. And these are not, again, to repeat myself, these are not new insights. If you really look into Gandhiji's model of India, I mean, he was talking about these things when he wrote Hind Swaraj in 1908. And that was what he envisioned, right? That communities would themselves be self-sufficient to run their own lives. Let's see how we can come out of this situation with some new models of work. And I think organizations like you, individuals like you have, and also there are many in the audience. I could see some very insightful comments from lots of partners who would have to show the path to others also. And I hope that the state, philanthropies, market, everyone would would join hands with social sector and try to move forward. If there are no comments, Sarshwat, I would like to invite my colleague Annapurna again to just conclude with her vote of thanks. Is it okay? Yeah, Annapurna, over to you.
Yeah, thank you, Nazrul. So when Shashwat told me, before the event started, that we are starting sharp at 5 o'clock, in my eagerness to, start the proceedings, I forgot to introduce myself. So I just want to say that, okay, I'm Annapurna. I'm a faculty member at the School of Development at Azim Premji University. Well, it's quite unconventional that I'm introducing myself almost when we come to vote of thanks, but yes. I just want to thank you all, Anand, Naveen, Mary. I've actually been furiously been taking notes as you were, highlighting your own experiences and shared what is likely to be the way forward and so on. Thank you very much for such a rich discussion. So the big questions, it's no longer about relief, like one of you said. It's no longer about relief, but we move from relief to rehabilitation to addressing new gaps that the pandemic has thrown up, and also build and prepare communities to address any such crisis in future. So that's a huge task ahead of governments, of everyone, and more importantly social sector organizations that because these are the organizations that are working with in difficult areas, in remote areas, in every day. So, if we have to accomplish that, then how do we support social sector organizations? How do we build the resilience of social sector organizations? So, I mean, thank you for bringing up some points as to how do we, come up with some new models. How do we look at some alternatives in terms of funding, alternatives, not moving away from a project funding, programmatic funding based model, to how do we build the reserves, right? How do we build contingency funds in social sector organizations? These are all thoughts, and we need to keep the conversation going. And obviously, not just the conversation, obviously, with the hope, conversation with the hope that it leads to action, and that we are in a better position, say, a few years down the line as we go along, that there is definitely a visible, perceptible change in the way social sector organizations are working and are being supported. So thank you very much once again. And Nazrul, thank you very much for the wonderful moderation of the panel. That was really very nice. I just want to take this opportunity to thank the audience who have spent time attending this webinar, and also want to thank a few, my colleagues who have been associated. I want to thank Pooja and Richa, my colleagues. Richa started this event today. Pooja also had given her inputs on our study earlier. I want to thank Sachin, Shashwat, Aditi, Vipul, and Nitya from the communications team. They made this, in such a short span of time. We got the report ready, the event was ready, the invitation went out, and I mean, it was really wonderful. Thank you so much. Without their support, we could not have had this event today. And more importantly, all the participants of the study. I mean, the conversations were so enriching. I mean, it's not easy, for 107 organizations and 28 organizations that have spent so much time. Uh, I mean, enriching. I mean, we actually had a much better understanding of the way things were unfolding on the ground. Thanks so much for all the organizations as well. And with this, we come to the end of this event today. Thanks once again.
Thank you.
Thank you.